Good morning. My name is Stephen Guffey, and I'm Associate Professor of Physical Therapy at Arkansas State University. I want to show you some new technology today. It's called a ThermoStim Probe. It's a very good new piece of equipment to treat a host of musculoskeletal problems. ThermoStim Probe is a device that allows us to deliver either heat or cold, while we can also couple a delivery of electrical stim. Our patient today has a chronic hamstring, medial hamstring strain. The area where she has some adhesions is at the musculotendinous junction of the medial head of the hamstring. So what we're going to do is we're going to deliver heat and electrical stim while we do some soft tissue mobilization. If you look closely at the ThermoStim probe, you can see we have a flat surface, but we also have some edges that will allow us to apply pressure, break up adhesions, mobilize soft tissue while we're doing the treatment. We have the patient included in an electrical stim circuit. We're going to deliver biphasic waveform with a pulse duration of 250 microseconds and a pulse rate of 5 pulses per second. We're going to bring the intensity up once we introduce the treatment so that the patient gets a motor response as long as she remains comfortable. So let me know when you can feel the stim. Okay, and then we'll bring it up a little more till we get a muscle twitch as long as you're not uncomfortable. Okay, good. So we've got a little bit of a muscle twitch. And now what we'll do is we'll begin the treatment by covering the area, all the soft tissue around the area of the injury with our heat and our stim for a few minutes. And as the patient beginning to get some of the pain relieving benefit of the stim, we're going to begin our soft tissue mobilization. We can begin with some compressions and circular motions, and then we'll progress that to coming up on the edge with the ThermoStim probe. And as we engage the adhered area, we're going to do some cross-frictional work, and then we'll occasionally smooth that out, and then we'll come at it from an opposite direction, and then we'll smooth in that direction, and then we'll do some digging from another perspective. Each time after we apply some pressure, it's probably a good idea to use the flat surface and deliver the stim and the heat to kind of calm the patient a little, and that way we can go back using edges and feeling of the adhesions in the tissue. And we're just going to proceed with that kind of an approach for about 10 to 15 minutes so that we can get the benefit of the heat and the stim, and it'll give us plenty of time to work the soft tissue. Timing will be kind of predicated on the patient and where the patient is in terms of his or her injury. But in this case, she's become chronically inflamed. She's no longer progressing through the normal phases of healing. We need to actually produce somewhat of an acute inflammatory response to kickstart her healing process again. So when we complete this treatment, then we'll probably follow it with some stretching. And we probably need to do this on a fairly regular basis, at least 3 times weekly, and then adjust based on her response in terms of the reduction of her pain and of course, the improvement of her function.